Hello friends, I am presenting to you the case of laparoscopic myomectomy in which there was a 22 years female with approximately 8 by 8 centimeter intramural fibroid. So as you can see, there's a huge intramural fibroid. So we'll be starting the case by ligating the uterine artery at origin. Here, we open up the lateral pelvic wall parallel to the infundibulopelvic ligament, identify the obliterated umbilical ligament. You can identify the peristalsis of the ureter. Here, you can identify the obliterated umbilical ligament, the uterine artery at the origin, and the ureter medial to it. We use laparoscopic clip applicators to clip the uterine arteries, which we can also remove later. A similar method is being used on the right side. The right pelvic wall is being opened up parallel to the infundibulopelvic ligament. Obliterated umbilical artery is identified. Uterine artery at origin is also identified by dissection technique. You can observe the pulsatility of the uterine artery. Right uterine artery is also being clipped. Injection vasopressin diluted with normal saline is injected to further decrease the blood loss. You can observe the uterus has been blanched and now the cold scissors are being used to reach the fibroid. Harmonic scalpel can also be used to dissect the fibers of the myometrium and remove the fibroid. Barbed sutures are being used to suture the myometrium in layers. There is not a certain way to suture the myometrium. In fact, the only thing which we need to keep in mind is the tightness of the sutures. There should not be any dead space left. There should not be any hematoma post operatively. As you can see here, the superficial layer of the uterus is been tightly closed and is well approximated. There was also a small 2 by 2 centimeter subserosal fibroid in the posterior aspect, which was also removed. Lastly, the hemoclips were removed as the patient was wanting fertility later. The fibroid was morcellated. At last, interseed was placed over the raw surface so that there are no adhesions later on.